And welcome back to Noon Edition. We are joined now by Tammy Goff. She is here from the Allen County Health Department, and Doug LaRue from Lima Memorial Health Systems. And we're talking about Narcan, and that's something that we have discussed before. What do you got for us today other than this person?
I just wanted to update people that Narcan's been in the news a lot lately, that you can actually buy it over the counter now at drugstores like Walmart, CVS, Rite Aid. That doesn't change that we have it available at the health department through our Project Dawn and through many partners. So we can give it to you free. So continue to come to us as a source for that Narcan, because unfortunately the overdose problem is not going away.
Right.
In 2022, we had 47 overdose deaths in Allen County alone, and that is the highest annual number we've had since this crisis began back in the mid 20-teens. So it is unfortunately, still going on. Two new partners we have that are helping us with distribution is Shawnee Township Fire and EMS and Police and Bath Township EMS. They're doing a leave behind program now, where when they respond to an overdose, before they leave, they actually leave a Narcan with the family or the friends wherever the overdose was. So I invited Doug here today to help us get that perspective. He's the EMS coordinator at the hospital.
All right, Doug, what do you got for us? How do we administer Narcan?
It's actually very simple. All of our goals is to save more lives. And like Tammy said, each year over 100,000 people actually die from opioid-related overdoses. So these Project Dawn kits have been a real lifesaver. Basically, to administer the Narcan, you want to make sure they're unresponsive. You got to look for some signs and symptoms: cool, clammy skin. A lot of times they're going to be unresponsive. They're not going to be arousable, agonal, or no breathing at all when you get there, and then everybody arrives. We've been doing this with our local police, and basically all you do, this is your Narcan. You administer it basically intranasally or inside the nose. Click it, you hear that click, and then you're done. Now, as you notice, there's 2 packs in here, so maybe the first one isn't working. Reevaluate your patient. You may have to give it again in 2 to 4 minutes. And then the hope is that we get our patients, to behavioral health, to change our life. So
now, if you have to apply a second time, do you use the same nostril, or do you go back to a different one?
You'd want to use the other nostril at that time.
Okay.
And you may have to do a couple other things. You may have to do rescue breathing, which is mouth-to-mouth on the patient. And in your kit, you actually have this nice little cover or barrier. And then the other thing is you may have to do CPR.
Mm-hmm. But that stresses the importance of, before you use the Narcan, try to call 911 or have someone else call 911. That way, if you do need more doses, you already have help on the way.
Now, when it comes to Narcan, this is something that most people are becoming very familiar with, but the average person like me, I'm not going to know if I walk up to somebody necessarily whether they're in a drug overdose, whether they've had a stroke or a seizure or something. How do you determine when to use that? Well,
the naloxone drug only reverses an opioid overdose. It does nothing else to the body, so it can't harm someone. So if they're unresponsive and they can't tell you, it is not going to hurt to try it.
Okay,
that's a good thing Tammy's stressing. In the EMS world, unconscious, unknown, we automatically give Narcan. So it's not going to hurt the patient.
Okay, very good advice, good things to know. And as you said, they can pick that up at the health department.
Absolutely.
Now.
Yep.
Okay, good to know. And medical is coming up next as we continue on Noon Edition.